Us on number of WHO.
To overcome these fragile times, we must do better at sharing resources and health tools. Our mutual resilience is only as strong as our weakest bond. Vaccine injustice is a shame on all humanity. And if we don't tackle it together, we will prolong the acute stage of this pandemic for years, when it could be over in a matter of months.
From Geneva headquarters here in Geneva.
I was stunned by the news that J&J vaccines, fill and finished in South Africa, are leaving the continent and going to Europe, where virtually all adults have been offered vaccines at this point. We urge J&J to urgently prioritize distribution of their vaccines to Africa before considering supplies to rich countries that already have sufficient access.
Technical lead on COVID-19, Dr. Ibrahim.
The people of Afghanistan are also facing an enormous challenge. In the midst of a pandemic, we are extremely concerned by the large displacement of people and increasing cases of diarrhea, malnutrition, high blood pressure, probable cases of COVID-19 and reproductive health complications. There is an immediate need to ensure sustained humanitarian access and continuity of health services across the country, with a focus on ensuring women and girls have access to female health workers. We're particularly concerned about the health and well-being of women and girls. I call on the international community and all actors to prioritize their access to all health services and to safeguard their futures.
We have Steve Solomon, who is a principal.
This week, a new case of Ebola was identified in Côte d'Ivoire, marking the third outbreak of Ebola this year. The patient confirmed with the Ebola virus had traveled to Abidjan by road from Guinea, putting both countries on an emergency footing. Thousands of doses of Ebola vaccines were sent from Guinea to Côte d'Ivoire, and ring vaccination of high-risk contacts has started.
We will remind journalists to ask.
Because Delta is so much more transmissible, we do see these breakthrough infections occurring in people who've received both vaccines. But if you look at the outcomes that we are really concerned about, which is severe disease, hospitalization, and death, those are clearly being prevented by the vaccines, and that's true for Delta as well. We believe clearly that the data today does not indicate that boosters are needed. And we need to know which groups, at what period after the vaccination, and which particular vaccines people have received in their primary course.
Thank you, Simia. I understand.
No vaccine is 100% effective. And if you have high vaccination coverage, you will, of course, always have cases, breakthrough infections, or what we also call primary failures, where the vaccine actually doesn't work. That is normal, that occurs. And the proportion to which this happens may differ from vaccine to vaccine.
So let's go to next question.
The analysis is extremely complicated because obviously we have not many studies, we have different vaccine, we have the emergence of variants, and we have different population groups. But what is clear is that we do not have sufficient information, and the data are not suggestive that at that point in time we need booster vaccinations.
From Swedish newspaper, Gunilla?
I think, though, regardless of what ultimately the science comes to an agreement regarding the length of protection or the increased benefit from marginal increase in benefits from having booster doses, the reality is right now today, if we think about this in terms of an analogy, we're planning to hand out extra life jackets to people who already have life jackets, while we're leaving other people to drown without a single life jacket. That's the reality.
Thank you, Dr. Ryan.